Hi, my name is Michelle Henry. I'm with the University of Texas at Arlington School of Nursing, and today I will be doing a focused exam on the chest and the thorax. Today we have our patient Michelle. She's here for her physical exam. So hi Michelle, my name is also Michelle. Thank you so much for coming into the clinic today for your physical exam. Of course. Today we'll be doing a focused exam on the thorax and the chest. I've already reviewed your vital signs and everything is within normal limits. And I have also reviewed your systems and everything looks great with that too. Okay. Do you have any questions at this time? No. Or anything you want to add? Okay, perfect. First, let's start off by getting a little bit of history. Okay. Have you had any health changes since your last physical?
Only changes, I'm now pregnant.
Oh, great. Congratulations.
Thank you.
Are you having any respiratory problems with breathing or coughing?
No coughing, but I do have some shortness of breath sometimes.
Okay. And when did this start?
Probably about a month or two into my pregnancy.
Okay. And what brings it on?
Physical activity, so taking the dog for a walk or something.
Okay. And how long does it last?
The whole time I'm doing the activity.
Okay. And what do you do to alleviate the shortness of breath?
I'll either stop and take breaks or I'll slow down. So like if I'm taking the dog for a walk, I'll slow down walking.
Okay, great. Do you have chest pain with this?
No, not chest pain.
Okay. Do you have any past history of respiratory infections?
No.
How about family history of allergies, tuberculosis, or asthma?
My mom has a history of asthma.
Okay. And do you smoke?
No.
Do you live with a smoker?
No.
Okay. And when was your last TB test and influenza vaccine?
TB test was about 8 months ago and flu vaccine was about a month ago.
Okay, great. Wonderful job of keeping on top of your vaccinations. That's very important. So this concludes the respiratory history right now. Do you have any questions or anything else you'd like to add? No? Okay. Okay. And are you feeling sick otherwise in any other system that you have? No. Okay, perfect. So let's go into the assessment portion right now. And what we're going to do for the chest inspection is we're going to look at her thoracic cage. And when we do a respiratory assessment, we want to do the anterior and posterior. We have to do both sides, and we want to go left to right, left to right. We want to make sure that we're very symmetrical. So the first thing that I'm going to do is do an inspection, and we're going to look at her thoracic cage. We're looking for her shape and her configuration. We want to make sure it's symmetrical, an elliptical shape, downward sloping ribs about 45 degrees to the spine. And she looks great. One of the things that we could be looking for is a barrel chest, kyphosis, or lordus, which Michelle will probably get a little bit of once her pregnancy progresses. Her scapula are nice and symmetrical. Her neck and trapezius muscles also are well developed and symmetrical. The next thing we want to look at is her facial expression as well as her position. She is nice and relaxed. Her arms are down by her side. If she was leaning forward or like in a tripod position, that might be indicative of COPD. We also want to look at her skin color and condition. We're going to look at her lips, her chest, and then her nail beds. And hers are nice and pink. There's no signs of cyanosis. The next thing we want to look at is her skin, the lesions. And so I'm looking at the front and the back of her right now, and I don't see any type of lesions. The last thing that we're going to do is check for respirations. We want to see a nice, effortless, regular, and even respiration rate, and she has that. We also want to look at her chest expansion just to make sure it's symmetrical, and I can see that in the front and the back. She's not using any accessory muscles, no pursed lips or nasal flaring. Okay, so Michelle, if you could turn around, we're going to do the posterior side first. So the first thing that we're going to do is palpate. We're going to do a symmetric chest expansion, and we want to do this between T9 and T10, and we're going to put our hands together here, and we're going to squeeze together a little bit. And I want Michelle, I want you to go ahead and take a deep breath. Okay, so you can see my hands moved apart. That means she has great bilateral chest expansion. If it was unequal, that would be signs of atelectasis, fractured ribs, possibly pneumothorax. And did you have any pain with that? No. Okay, great. If she did, that would be a sign of inflamed pleura. The next thing that we want to do is called tactile fremitus. This is a palpable vibration, and I'm going to be putting my hand on the back of her chest, and I want her to say the word 99. So we'll start at the apices and then move across symmetrically.
99, 99, 99, 99, 99, 99, 99, 99. 99, 99.
Okay, great. She has great, I can feel the vibration in my hand, and that's what we're looking for. If it was decreased sounds, that might be a sign of obstruction or a pneumothorax. If it was increased, it would be a sign of consolidation. Lastly, we want to palpate the back of her chest wall. We're looking for crepitus, lesions, temperature, and moisture, and that looks great. So the next thing that we're going to do is percuss her lung fields. We're going to start at the top at the apices and move across the shoulders in a very symmetrical left to right. We want to compare one side to the other. And we're looking for a sound called resonance. This is a low-pitched hollow sound, which is normal in healthy tissue. If we do it over the scapula, it will sound flat. And if we do it over some organs, it will sound dull. So you want to take your middle finger and then one next to it, and then you can just start tapping at the top. So we're just tapping. Okay, great. Michelle has great resonance in her. If it was hyperresonance, that would be something that has too much air, like emphysema or pneumothorax. It was dull in areas that should not be dull. That could be a sign of pneumonia or atelectasis. The next thing that we're going to do is a diaphragmatic excursion. And so we're going to percuss all the way down. And so, Michelle, I want you to hold your breath, exhale and hold your breath. And I'm going to start percussing. And we're looking for the change in sound to be resonant. Okay, so it's about right here. We'll mark the spot. So we're going to move from up here to here. And what we're looking for is the sound to change to a dull sound. So Michelle, go ahead and take a deep breath and hold. Okay, so that's about right here. So the difference between the two should be about 3 to 5 centimeters, and hers is within that range, so that's good. The last thing we're going to do is test the costovertebral angle, and this checks for kidney pain, and it's at the 12th rib with the spine, and I'm going to place my hand and then just hit it on both sides. Did you feel any pain with that?
No.
Okay, that's great. That means she does not have any kidney inflammation. The last thing that we want to do is auscultate. We're going to listen to her breath sounds. We're looking for the presence and quality of sound. There are 3 sounds. The first one is bronchial, which is in the trachea. That's a harsh, hollow tubal sound. Vesicular, which is in the lungs. That's a rustling, kind of like a wind in the trees. And the bronchovesicular, which is in the middle, which is more of a mixed sound. So Michelle, I'm going to listen to you. Just take a breath when you feel my stethoscope. We're going to start at the apices, the supraclavicle, and then move across down to the 6th rib. Once again, symmetrical, left to right. That's your arm. Thank you. Okay, Michelle sounds nice and clear. Some of the things that we would look for are something called adventitious sounds that could be crackles or wheezes. Increased sounds could be a consolidation of pneumonia. Decreased sounds could be obstruction from secretions or foreign body. So now, Michelle, why don't you go ahead and turn around. We'll go ahead and do the anterior portion. We've already done the inspection. Her thoracic cage looks great. She has good shape and configuration. Her color, she's nice and pink. No signs of cyanosis, as well as her respiration is effortless. So what we want to do is do the tactile fremitus on her again. So we're gonna, once again, put my hand on her and she's just gonna say 99, 99, 99, 99, 99, 99, 99. Okay, so we wanna make sure we don't go over and females on the breast tissue because we won't really be able to hear that sound. We also wanna go ahead and just do palpate the rest of it. And also be careful of the breast tissue. And I see no crepitus lesions. Her temperature is nice and warm, and so is the moisture. So we want to go ahead again and percuss her lung fields, and we're looking for that resonance sound. So let's do the same thing at the top from the aphyses and move across left to right. And go underneath the breast tissue. Okay, great. And she has good resonance sound. The last thing we're going to do is just auscultate her lungs, and we're looking for the same sounds again. Okay, take a deep breath. Okay, great. Michelle sounds nice and clear. And so at this time, this concludes our assessment. And other than the shortness of breath that we talked about, do you have any more issues or concerns?
No, I'm good.
Okay, great. Thank you so much for coming into the clinic today for your physical exam.
You're welcome.